Hello, everyone, and welcome to Yogaberry, your yoga for scoliosis community. My name is Christine Jaregiberry, and this is Back Chat, our weekly live stream, which is just for you. And the purpose really is to share more about scoliosis and back care. And sometimes I've got interview guests here to chat with me. Today, it's just me. And I'm going to be talking about lumbar scoliosis. So, those of you who have been following me on Instagram, I did ask the question in there. So, some of you have sent me your questions already. But obviously, if you are joining me live, then feel free to chat with me. So, let me know where you're tuning in from. This is not only for me to know where you are in the world, but this is also for you to maybe be connecting with others. This is really important to me, and this is really what this whole kind of Yogaberry project is all about, because I want people that suffer from scoliosis to feel seen, to feel heard, to be able to connect with others, to be able to have access to all the resources and have access to knowledge, have access to help, and be able to do something about the condition and just live as healthily and happily as you can in your body. So feel free to let me know if you've got any questions. I'm just having a quick look here at the chat, just checking that everything is working all right. So please do let me know if you are watching live. Just send me a little message there to tell me. Hello. Okay, good. This is also just to let me know that my microphone and everything is working. You know what it's like with technology. Sometimes it works, sometimes it doesn't. If it works, then it's amazing. If it doesn't work, then it's not so amazing. So somebody's just saying hello to me, which is great. Good. So I'll just bring up the picture of what it is that we're going to be talking about today. So there we are. Hi, Jimmy. Good. You can hear me. Okay, perfect. Right. Um, so yes, guys, do let me know where you are in the world. Let me know what time it is of the day. For me, it's 4 o'clock in the afternoon, and this is when this thing is happening. Back chat every Wednesday at 4 p.m. UK time. So if you do want to join me live, then that's amazing, because then we can make this much more relevant to you, right? You can ask all your questions. And if not, you can watch it on the replay. So let's get back to this. So we are talking about the lumbar scoliosis here. So you can see the lumbar vertebrae are the blue ones here at the bottom. So if they are affected, then it's usually called a lumbar scoliosis. If it's a little bit higher up, and if it's in the lower back and the mid back, so in the lumbar spine and a little bit of the thoracic spine, it could also be called a thoracolumbar curvature. So you might have heard those terms before. So it depends on what you have been diagnosed with. So just to kind of go over some of these terms a little bit, because I know that this can sometimes be confusing when you've been basically diagnosed with a levoscoliosis, but you're not quite sure what that means. So if this is the case, levo means left, roto means right. So sometimes they use those terms. Sometimes they use uh, dorsal spine, sometimes they use thoracic spine. So unfortunately, all these physios and doctors, they have different ways of interpreting things. Sometimes they look at the where the convexity is. So the convex side would be the one where you see the red dot here at the moment. That would be the convex side. Sometimes they look at the concave side more, which is the one where the red dot is not, so on the other side. Good. So I recently got a scan that says I have mild thoracic dextro scoliosis. Your channel is a lifesaver. I'm so glad to hear that. And the fact that you have a playlist just for it is so great. Thank you. Well, you are very welcome. And interestingly enough, this is probably one of the most common curvatures. So dextro, another confusing term. Obviously, dextro also means right. So dextro scoliosis is a scoliosis curvature to the right, and yours is in the thoracic spine, which is the one in purple here. And yes, the reason why I have a playlist for this is because most thoracic scoliosis curvatures, in my experience with all my clients and all the yoga students I've been working with scoliosis, most of them, I'm not saying all of them, most of them go to the right. And so a spinal surgeon has explained this to me before, and he mentioned that the body is basically very clever. And if there is an imbalance, um, during growth, basically the spine is avoiding the heart, right? Because a left thoracic scoliosis would be going straight into the heart, and that what could cause problems. Doesn't mean that it will, but it could. So most thoracic curvatures are going to the right. So we are talking about lumbar curvatures, obviously today, so the lower back, and most of these seem to be going to the left. Again, obviously, if you're now saying, well, mine is going to the right, this is kind of a general, this is basically my own statistic and basically from what I have seen, and most of them seem to be going to the left. Same with thoracolumbar curves. So if they are a little bit higher up, they also seem to be going more towards the left. Good. So we've got Laurie here from North Carolina. It's 8 a.m. Lovely. Hi from the Philippines, 11 p.m. So I'm so happy that you're making time um, to look at this and to be here live as well and to chat with me. So do let me know if you've got a lumbar scoliosis and what your questions are. So let me just have a quick look here from what the guys on Instagram have said. So basically, also if you're not following me yet on Instagram, make sure that you follow me. I do post little practice videos and just little snippets of my practice. So it's a great way also to keep motivated, I guess, and having something to tell you every single day. Let's do something. Let's do some exercise because studies have shown it doesn't even matter so much what exactly you do, as long as you do something. That is probably the most important thing of scoliosis. Having said that, obviously, if you do the right exercises and if you do exercises that um, work with your curvature, are tailored towards your curvature, then you will make the better impact. And if you haven't checked out my interview from last week with Tony Nalda, please do check it out. It's very, very interesting and his take on exercise as well. Good. Hello, I have a right thoracic lumbar curve. So I think you mean a thoracolumbar curve. Yes. I want to know how type nutrition is important. During scoliosis, I lose my weight. In India, we have no treatment, only surgery. Um, yes, it's a difficult one, and I know treatments is sometimes it's difficult to find people that know about scoliosis, right? So lots of physios, even if you go to them, they obviously in their school and in their college and university, whatever they've attended, they will have learned about scoliosis, but probably more kind of quite general. So in terms of nutrition, I'm not a nutritionist, so I cannot give you advice on that. However, I am still looking for someone who can help me with that. But again, if you look back at the expert interviews, I have had one interview with a nutritionist, so you could have a look at that. Good. So greetings from Singapore. So Jimmy's got a curvature going to the left. Katie is saying, I fear that my back is very heavy, too much heaviness in my vaginal area. Want to use the restroom all the time. So that would be your pelvic floor, right? And this is definitely something that can be impacted by scoliosis as well. So there could be obviously other reasons why you're feeling this. It could be that you've had children, you have given birth, you've generally got a weak pelvic floor. But scoliosis does affect pretty much the whole body, and especially lumbar scoliosis, I have found. I've also found that people that have lumbar scoliosis seem to have more pain generally than people that have just thoracic scoliosis. So I find generally thoracic scoliosis, those people have got more, because it's more visible, they have got more issues with their body image and they don't like the way it looks. If you've got a lumbar scoliosis like me, I have a left lumbar scoliosis as well. It's pretty, you can kind of hide it, right? So if you look at my videos when I'm practicing, it's quite difficult to see that I have a curvature, because I'm quite good at hiding it, and I have obviously trained my body as well to correct my posture. But nevertheless, there is still a rotation going on. So if you look at that lumbar spine here, imagine what is involved here. And we know, or if you have been following this YouTube channel, you will know that scoliosis is not just a curvature to the side, but it also comes with a rotation, right? So that part that is in red here with that red dot here is rotated back, so coming back towards you. So this will be the hump side. So if you look at someone from the back that has scoliosis, it might be a little bit more bulky on that side. So because of this rotation, this obviously translates, it's not an isolation thing. It's not just in this part, but it will be somewhere showing up somewhere above and somewhere below. And the problem with below is obviously this is where the sacrum is, and the SI joint, which is the one at the back of the sacrum, which is there to be stable, right? So it's keeping everything together. The reason why there's a little bit of movement is because for women, we do give birth, right? And then everything needs to kind of stretch and widen and make room for the baby, obviously. And then it needs to become coming back together. So SI joint, there is a little bit of wiggle room. And the problem here is with that scoliosis, it can be kind of twerked around and it can be kind of pulled into an awkward position. And this is why a lot of people do get pain in this area as well. So if you kind of imagine, and this is not a, you know, no scoliosis is the same as somebody else's scoliosis, and this is just a graphic, obviously. But if there is a curvature to the left, there's also a tiny little curvature compensating towards the right, lower down, right? Because it's basically coming back towards the sacrum. And this is what I'm talking about. So if you have lumbar scoliosis, have you noticed that there is a difference in your hips? Is one hip higher than the other? Does one hip look like it's forwards a little bit more than the other? So these would be my questions, and just something to kind of notice. And also to notice if you have a tendency to cross your legs always the same way around. And this is another sign of that rotation that is happening in the lumbar spine. Good. Tatiana is here. Hello, good morning. I would like to ask, if sitting with scoliosis, which leg is better to put on top? It's better if the left curvature of this, if it's the left curvature of the spine. So let's think about this. I would try out, and I have been thinking about this a lot as well. So there are a few different things here to consider, right? So if you have a left lumbar curve, is your right hip higher than your left? Possibly, right? So this might mean that you want to lift your left sitting bone slightly up, right? So this, I would conclude from that, it's better to lift your left leg over the right. However, this pulls the left hip forwards, right? This is not what we want, because it is actually the right hip is already back. So we want the right hip to come forwards. So basically what I'm telling you is don't cross your legs at all, because this is just gonna bring in another dimension of making it more awkward in a different position. And I'm really struggling with this. I have to be really disciplined, and I'm being completely honest here. So if I sit down, that's the first thing I want to do. I want to cross my legs, right? Um, but usually this has something to do with stability and with core strength. So I am working really, really hard to strengthen my glutes, strengthen my hips, to strengthen my core, this whole area to be able to support me and not trying to kind of rely on this kind of weird rotational position. If, however, so if this is not an option not to cross your legs, then change it up. Make sure that you do both so that you don't fall into a pattern and fall into a habit of always doing it one way. So that would be my advice for this one. Good. Sometimes we need subtitles on your channel. We watch all your videos and you're doing a good work towards scoliosis. I know, and I think you can just turn the subtitles on, even though sometimes the translation is a little bit weird, isn't it? Hi Alice. Good. I have my ribs very emphasized in the left part. Does it mean I have a curve to the left of my scoliosis? It could be, Alice. And if you're talking about ribs, that sounds to me that this is a little bit higher up than the scoliosis that we're talking about today. So that would be probably more that your scoliosis curvature is in towards the purple part. And yes, it could absolutely be that it's going to the left. But the only way to really find out is having an X-ray, I'm afraid. The other way would be to do the Adams forward bend test, and I have got a video about this on my channel. And it's called, I think, something like how to look at your curve pattern or something like that. So it's on the front page, and it's in the kind of basics playlist, and I highly recommend to check this playlist out if you are new to this, and that will give you a good idea how to do this Adams forward bend test, and that's when you can find out which way your curvature is going and where exactly it is. Good. Right. Tatiana's asking, how about if a watch TV, is it better sitting or lying? Hmm. It depends. How would you lie? I mean, generally, any posture that you are in for a long period of time is not a good posture. So the best posture is a moving one. Yes. So if you can change it up, then that is probably the best idea. So if you are sitting, make sure that you keep changing. Um, the worst one is probably where you're kind of slouching and where your head comes forward. This is kind of a posture that unfortunately most of us suffer from nowadays because of these devices here, because of our phones, and we're looking down towards them all the time. So most of us, or a lot of us, have got this forward head posture. So if you're thinking about kind of lying down on your bed and having quite a big pillow and then looking at something, I don't know how you're watching, if you're watching on a tablet or if you're watching on TV, that's not a good idea. So I don't know what you mean by lying down, but I would make sure to change it up. Good. So Jimmy is saying, I have found that Dr. Stuart McGill has some excellent stretches that have actually worked for me. Great, brilliant. I will check him out. I have not heard of him before. But yeah, it is about, and I'm glad you're saying this, Jimmy. It's about finding something or finding someone that you connect with, right? And that you like, listening to, and that you where you enjoy the exercises that they're offering. So I'm not saying that what I do is kind of the solution for everyone. um, it's really important that you find something that helps you, right? The rest is just kind of statistics, obviously, and that doesn't really matter. It really matters what makes you feel better and what works for you. And that might mean sometimes trying out a few different approaches. Good. So Laurie is saying no back problems until 5 years ago at 60. Oh, dextroconvex lumbar scoliosis. So dextro, remember this is the right curvature, so hers is going to the other side, and she's got a listhesis as well, right? So this is where it gets a little bit tricky. So a listhesis is a slippage of the vertebrae, probably to the side, but I don't know. I would need to know a little bit more about this. So now 3 inches shorter with extreme kyphosis and shortness of breath, making even a short walk difficult. Yes. Oh, I can imagine that must be quite hard. So kyphosis, especially now, this is when everything comes forwards and the muscles really start to tighten here at the front of the chest, and that can make breathing really, really difficult. So um, in yoga, what we do is we do focus on relaxation and breathing exercises quite a lot as well. And as much as, strengthening and great posture, I think this is really, really important. So yes, and sometimes with these very specific cases, I would really urge you to work with someone one-on-one, and not just follow kind of a general exercise video. So if there's too many components to it, and you're telling me if there's a listhesis, there is a kyphosis, and there is a scoliosis, that's quite a few different variables here. So it's really, really important to find the right things to do here. So before I come back, don't worry, I will look at the chat as well, but I just wanted to answer some of the questions that the guys on Instagram have sent in. So someone said, do women with lumbar scoliosis have more pain during their pregnancy? So, and I thought that was a great question, because that's a lot of people, that's what, well, including myself, that's what I was worried about before having children. And again, I've got a couple of interviews with ladies that have given birth as well that you might want to check out if you're worried about pregnancy. And then the other thing I would say is where the lumbar scoliosis is, obviously, this is the region where the baby grows, where all the organs are. So, yes, of course, you would be worried about this, but there is no direct correlation between scoliosis and pain. So that's just something to bear in mind. And I'm not saying that scoliosis cannot cause pain, because it absolutely can. But what I mean by that is that just because you've got scoliosis doesn't mean that you've got pain, right? And also, the more severe your scoliosis is, doesn't mean that you have got more pain. So that's just one thing to bear in mind. And I've asked many, many women about this that have given birth, and that as long as you stay active, as long as you stay healthy, there's no reason why you would have pain during your pregnancy, right? So that's just something to reassure you here. Good. So Laura asked about restorative poses as well. So I just wanted to address this. Which is the best restorative pose for left lumbar scoliosis like yours and mine? So we share the same curvature. And so restorative yoga, for those of you who don't know what that is, we use a lot of blankets and pillows and props to prop up the yoga poses, make them super comfortable, and then we stay a little bit longer in them. So it's a very quiet practice, and a lot of it is kind of lying on the floor. So there are no active poses, but you might be supported into different shapes by pillows or by blocks. So how this practice is really useful is because it does release tension, and it can release muscle tension, emotional tension, anxiety, and all of that, which can also be linked to back pain, obviously. So what I would say to you, Laura, is restorative yoga poses, think about what you want to get out of them. So if for my lumbar scoliosis, for example, depends on how I feel, but a lot of times I've got tight psoas muscles, right? Tight hip flexors. which are directly linked, which is directly linked to scoliosis. So I would practice some poses. For example, just lying on my back and bringing the backs of the knees onto a chair. So that's a great one to release tight hip flexors and just lying there for a few minutes. We've got that side lying yoga pose on your yoga bolster. If you lie on your yoga bolster, make sure it's on the peak of your convex side. That's where you want to bring the bolster, and then just lie on your side, breathing into the opposite side. This is great to create a little bit more space, to release muscle tension. Um, so yeah, they are just a few yoga poses. Let me think if I can think of some others for restorative yoga. Again, it depends on what you want to do. So anything where you would be lying on your back is where make sure that you're well supported, so that your convex side especially is well supported. And if you do want to know or learn a little bit more and experience restorative yoga, then I am doing a workshop on Sunday at 3 p.m. UK time, and it's a 3-hour yoga workshop where we can explore those poses a little bit more and really find some ways of tailoring them to your scoliosis as well. So that would be my advice to you. Let me come back to the chat over here. Right. Where are we? Hi, Christine. I'm sorry. I'm just entered this room as traveling herd. You were talking about some crossing legs while sitting. I have also a habit of crossing legs while sitting or lying. Could you please suggest? Yes, and you might want to listen back to the beginning afterwards where I talked about crossing your legs. So yeah, make sure to listen to that. But Laurie is saying your videos are excellent in helping us understand our wiggly spines. Oh, good. I'm glad. And I know this is a really complex topic. And I know that, again, every scoliosis is obviously slightly different, but all that I can do is obviously share what works for me and what has worked for my yoga students, and hopefully getting you curious about your condition and hopefully helping you to start somewhere and to start practicing yoga. And once you start practicing, that's where you learn, right? So it's not just through watching watching YouTube videos, but it's when you actually do it, that's when you learn. Good. So, right. I have no problem walking as I walk 1 hour daily. Walking is great. Fantastic, Jimmy. My pain starts when I get in the car on the way back home. I use towels on my left in the car and sitting at home. Those really help. Yes, and that's a great suggestion. So, Jimmy, from memory, I think you said you've got a left lumbar curvature. So remember what I said in the beginning. So wherever the convex side is, that's where it's more bulky, right? That's where it's rotated backwards. So putting a cushion onto that side is a good idea because it kind of de-rotates the spine as well. So long car journeys, make sure that your lower back generally is well supported so that you're not in a flexed position, meaning kind of rounding into the lower back. That's very bad. So make sure that your pelvis is in neutral, and then yes, you can consider supporting the convex side a little bit more. Good. So Alice is saying, thank you. I have checked that video and both my left shoulder and my left hips are higher compared with my right. So I guess it's both lumbar and thoracoscoliosis with curve to the left. Right. That doesn't give me enough information. So you would have to do the rounding forwards, or is that what you're saying? So are you saying in the rounded position, the left shoulder and the left hips are higher? If that's what you mean, then yes, that is probably a long curve going towards the left. I still find it hard to give it a name even after checking. Yes, absolutely. I know it's difficult, isn't it? Could this be hurting my kidneys and bladder? Well, hurting hurting. I don't know how many nerves there are in this area. That's not my speciality. But obviously, your scoliosis will have an effect on the organs, right? So when they have done dissections, for example, on dead people, obviously, they have found that yes, it's not only the muscles that are affected, but also the organs and everything else as well. So um, I don't know about pain, but it can definitely have an effect on the organs. That would be my um, answer to that. So Alice is saying, curiosity, did your scoliosis cure or at least got better due to all the exercise practices you are doing? Trying to see if it's possible to actually treat by exercise just and not surgery. So that's a great question, Alice. Um, so I don't think that well, first of all, if you're saying to cure scoliosis means that you think it's a disease, right? No, it's not. It's a condition and it's the shape of your spine. Um, Purely through exercise, you will not be able to dead straighten your spine unless you are still growing and you're kind of doing it with the growth. So that's when you can make some really big changes. If you don't grow anymore, it's very, very unlikely. I don't know of anyone who has completely straightened their spine through exercise, right? If that's your goal, then go down the route of surgery. However, having said that, you can absolutely reduce and you can improve and you can maintain your curvature. So really, your goal should be to be in kind of an optimal position, posture for your curvature right now and make sure it doesn't get worse, right? Now, having scoliosis doesn't mean, first of all, that you're weak, that you're sick, that you're fragile, none of that, right? So Usain Bolt, right, fastest man in the world, has got quite a pronounced scoliosis curvature. Does it impact his running and all of that? No, he is really, really fast, right? So I think your goal should not be to straighten your spine, but it should be to move well and to feel well and to be without pain now in 20 years and when you're 105 if you want to be that old. So that's my personal opinion. And then for my own scoliosis, I don't have any x-rays from when I was little, but just looking at pictures, I have definitely improved it. No, I don't have a straight spine again, and I do a lot of yoga, obviously. It's very, very difficult to see my scoliosis because I have become quite good at correcting my posture. But if you look at my X-ray, there is still a curvature. Now, I am not unhappy about this at all because I feel very well in my body and I move well and I can do anything that I want to do. I'm not limited by my scoliosis. So that's my answer to that. Good. I have done a full session of chiropractic treatment a few years ago. It helped me with pain management, but very little improvement in the curvature, that even the chiropractor was surprised. Good. So, have you watched that interview with Tony Nelder? Please watch it. He's a chiropractor, right? And he will tell you, well, just watch the video and that will probably answer your question already. So in that, he is saying that there is quite a big difference between different chiropractors and the ones that are not specialized in scoliosis. And he's also saying that purely chiropractic treatments will not have an effect on your scoliosis. So it has to be paired with something else. Asked me to go home and did exercise with weights and balance ball, but I did not really follow up as it is too tiring and painful sometimes. There's Laura as well. Hi, Laura. Um, yes, so I think it's really important, and having a good movement teacher, if that's yoga, Pilates, or physio or whatever, I think it's really important um, to start where the student is at, right? So that might not mean to give you kind of a standardized exercise program to say everyone with left lumbar scoliosis do this, everyone with right thoracic do this. That's not what it works like. Yeah. So if I work with people, that's not all I look at. It's not just your X-ray, right? It's how old you are, how much do you move during the day, how well do you move? You know, you might be hypermobile in some areas, you might have other conditions. So it's much more complex than that. And sometimes what happens is that people get a little bit overwhelmed with things that they get from their doctors and their physios, and I have done physio treatments as well, and then it doesn't really work straight away, and then you stop, right? So I think it's really important to keep going and maybe just dial it back. So I would have said to you, if you were my client, I would have probably said to you, do maybe less repetitions and do a little bit less, or do it every second day, but keep going and you will find an improvement. Now, it's not going to be that after 1 month you will have a straight spine as we established. Um, but hopefully, you know, things will look a little bit better and things will feel better. And really, that's the most important thing. Good. So, Laura, what was your question again? Oh, the restorative. I did talk about restorative yoga. So Laura, make sure that you watch a little bit earlier on. That's where I'm talking about the restorative yoga poses. So I wanted to address Hen's question as well. She's asked, can you talk about hip rotations and corrective exercise to do on each side? Also the plank effect. So side plank, now I don't want to open it up to like a completely different, because we could be here for 5 hours, right? And we're not going to be here for 5 hours. But if you are interested in the side plank, then do check out the playlist of Dr. Lauren Fishman, the Fishman method, I think I called it. So that's where you find all those videos. And yes, side plank is said to be a great exercise for lumbar scoliosis, especially, and you would practice it predominantly on the convex side of your lumbar curvature. So I'm not going to say more than that about this because it's going to take us down a rabbit hole. And then I did want to talk about a little bit about hip rotation and corrective exercise. So hip rotation, what you mean, well, there's a few things that you could mean. So it could mean that you think your pelvis is actually rotated to the side, or do you mean that one leg is rotated outwards and one is inwards? So and maybe if you are standing at the moment, just if you walk on the spot for a moment and then stop and you check if one foot is turned out more than the other, that could be a clue that there might be one leg a little bit more rotated outwards, or generally a bit more of a hip rotation there on one side than the other, which is very common with lumbar scoliosis. Yeah. So for me, for example, with my left lumbar scoliosis, my right leg is slightly turned out. So I work on internal rotation on that side. So internally, meaning inwards, and I work on external rotation on the other side. So you might want to check out some YouTube links for internal and external hip movements. Yoga generally does a lot of external rotation, but not so much internal rotation. So sometimes you have to kind of mix it up with some other exercises as well. So, for example, in Pilates, they do the clam, which is more of an external rotation, but internal could be if you're sitting in mermaid pose, so one leg in front, one leg kind of behind you, 90-degree angle, and you keep the knee down, so that you keep the back knee down, but try to lift up the foot. So that would be an example of an active internal rotation. So these are just a couple, something to think about. Good. So Tatiana is saying, I did yoga for 10 years, but special scoliosis yoga just started a couple of months ago. Should I stop doing bending, twisting poses? Yeah, and this is always one that comes up, and I have gone through this period of, talking to the Schroth experts, and they would be saying, do not do any twisting and side bending and all of that. So I don't have the answer to that, I'm afraid. Um, it depends. I think I would be really mindful about what you're trying to get out of your yoga practice and why are you doing specific poses. Are you just doing the poses because your practice demands it and because your teacher is telling you to do it? Or are you actually getting something physically out of it? And generally, the kind of lengthening poses in a neutral spine and stabilizing tend to be better ones for scoliosis. So if you practice yoga for your curvature, right? And if you have done my 4 weeks practice transformation, then you would focus on more of the neutral spine ones, and you would strengthen in those. And you would also, if you are doing other poses, you would slightly adjust them, right? If you do a twist, don't go as far. Think about what happens if you twist, right? Which part of your curvature gets worse and which part actually derotates. If you're doing a forward bend, think about where this could be a problem, right? And the Adams forward bend test already shows us that this could be a problem because if you're really rounding, that rotation becomes really, really pronounced. Same as with back bends. So if you're bending backwards and there is a bit of a twist and a twerk in there, one side bends more than the other, right? So maybe it's just doing less of it, maybe not going to your end range, not doing as much as you could do. Should you do as much twisting and back bending and forward bending? So that's where I would start kind of with these questions. And then start to really adapt your practice as well. So really get to know your curvature. Either X-ray, Adams forward bend test, draw it, make sure you can visualize it, and then think about how you could adjust the different poses. Where could you kind of draw in, where you could lengthen a little bit more, where could you create a little bit more space when you do your triangle, when you do your different yoga poses. So again, that's what we do in the practice transformation, where we transform your yoga practice. If you have been practicing already, but you want to really tailor it to your curvature, then that's a great option. And that's the link for that one is in the description. So Jimmy is asking about, and I'm just going to answer the last couple of questions because I'm just conscious of time. So Jimmy is asking, what about an inversion table? Are these good for this? So I don't have one personally. Some people find like inversion means, well, inversion means being upside down, obviously. That's not what I wanted to say, but an inversion table could be good to decompress the spine, right? Now, it depends on how much, and I think with an inversion table, you could, you don't have to go this way. You don't have to go kind of completely upside down, which is quite strong, and then you would just be hanging into the joints, but you could just kind of go a little bit, right? And then decompress that way. So I think that could be a good idea, but I don't have any personal experience with this. So I can't comment on this. However, I know that in Iyengar yoga, for example, they use the ropes. They like being upside down and to decompress, so it can feel really, really good. Good. So Alice is saying, is 24 to 26 years still good enough age to start correcting the scoliosis with possible good results? Yes, I think the younger you are, the better. The younger you are, the more chances you've got. And generally, I think your 20s are a great time to do something because, when you're in your teens, um, obviously there it's really important because you're growing and all of that. But if you're a teenager, you've got other problems, right? And you're probably not so interested in your scoliosis, and you're probably also not so motivated to do something about it because you don't have pain and because you don't think about it long term. If you're in your 20s, you're much more mature, obviously. You don't grow anymore, so the chances of having a straight spine probably not going to happen. However, you can really set your future up. And anyone who's kind of in their 60s, they will tell you, I wish I had done something about my scoliosis when I was in my 20s, because you can really make an impact then. Yes, and you can really, that's when I started yoga, right? In my 20s, and I got really, really interested in my body, in my learning as much as possible about my curvature and making sure that I stay fit and well and healthy and that it doesn't get worse. Again, I think that should be your primary goal here. And yes, you can do something about the appearance. If that's what you're worried about, you can definitely do something about it. Are you going to improve your X-ray? Potentially. But that depends on how much work you're putting into, and really, is it that important? I don't know. Good. So Laura is saying inversion tables with ropes are awesome. Okay, so Laura has got some experience with inversion tables. So there you go. So she's saying she feels a real relief there. So, yes, so I haven't got any personal experience with it, but there you go. I have heard good things about it. Is it better to sleep on a hard mattress or a memory foam mattress? Will the memory foam worsen the condition? So sleeping is not going to worsen your scoliosis, right? No matter how you sleep, right? You're not going to make your scoliosis worse or better, right? If you wake up and your back hurts, then I would think about changing something, right? If you're generally sleeping well, don't worry. Yes, this is not going to make it better or worse at all. So don't worry about it. However, if you're not sleeping very well and you wake up with back pain, then you might think about, how can I make this a little bit better? So generally, I would say harder mattresses are better generally for back care, because the softer ones you just kind of sink into. Sorry for the sound effect. Um, but at the end of the day, it depends on what feels more comfortable for you. And if you sleep on your back, if you sleep on your side, you might want to consider propping up the convex side of your curvature if you are lying on your side. And then in terms of which mattress, I would try them out basically. So I would try to see what happens. And I think memory foam can be I find them really comfortable. I don't know about you guys, but that might just be a personal opinion. Good, lovely. So thank you guys so much. I'm going to leave it at that for today. So tune in next week as well. So I am here every Wednesday afternoon. Actually, I have to think about if I'm going to be here next week because it's half term for us. So my children are on holiday. But let's say I will be here, and I will obviously post it here on YouTube, and we'll talk about a different topic if there is something you want to know, especially obviously I heard already nutrition was a request. If you've got any other requests, then do let me know. Um, but yeah, then I'll see you again on next Wednesday at 4 o'clock, or you catch me on the replay. Check out all the links in the description below if you want to dig a little bit deeper, if you want to get more into the practice, and maybe join me for the restorative workshop on Sunday. All right. Great to talk to you guys. Bye.